Hi, everyone. Welcome to Lipstick and Lipo, your unfiltered guide to plastic surgery by two board-certified plastic surgeons. I'm Dr. Smita. I'm a board-certified plastic surgeon in New Jersey, and we've got a great topic for you today. And I'm going to let my co-host, Dr. Amalfi, take it from here.
Yeah, so this is a huge topic, labiaplasty. And today we are going to talk about how do I know if I am a candidate for a labiaplasty? Like, who gets a labiaplasty? Patients ask me all the time, or even like friends in the community, they're like, how do I know that I need a labiaplasty? Like, who really is a good candidate? So I think this is a really great topic. And as two female board certified plastic surgeons, this is a huge part of our practice. So we're so excited to be here to give you real unedited information about it tonight.
Right. And I think this is so important because not a lot of people talk about it, you know?
It's
so
such a
there isn't
hard
a lot
topic,
of information. Yeah. It's such a hard topic to talk about.
We're here,
and,
we're going to talk about it all the time, guys. Lipstick and lipo.
I know.
We're going to talk about anything.
Nobody talks about it.
Yeah.
We don't post pictures about it, and so it's really hard for patients who don't really, they're unhappy with something, but they're not really sure if they're being crazy or if their reasons are valid. And a lot of times I find, and I'm sure you find this as well, they'll go to their OBGYN or, and they'll talk about their concerns. And obviously all that anatomy is normal.
Yeah.
No matter what it looks like, it's all normal.
Yeah.
So, and so that's what their OBGYNs tell them is, oh, that's normal. You have nothing, like, don't worry about it, and sort of brush them off. And so then, after doing more research, they end up coming in. But
and
this is a great
I tell
thing to
patients,
talk about.
Yes, it's absolutely normal. Just like no matter what your breast looks like, that's also normal. But if it's not something that you like, then that's okay, and we can totally fix it. Like if your breast is too small and you want it bigger, or it's too big, or it's too droopy, we can fix all of those things. And this is just like a secondary sex characteristic, just like anything else. And if there's something that bothers you about it, whether it's aesthetically or physically, it's actually bothersome to you, then come see us and we can totally talk about it. And so I'm sure you do too. I see patients all the time who are just really uncomfortable. Like it physically,
right.
their labia minora are very long or hang or just get in the way. And it's really, really bothersome. Do you see a lot of symptomatic patients?
Yeah. Well, so, I actually see more patients that are, they're self-conscious about it,
yes.
And I think it's funny because this procedure really kind of took off when like Lululemon and yoga pants and all of that stuff became more, the tight clothing became more popular because people were noticing they're like camel toe or whatever,
Yeah.
So I think for me, most of my patients don't necessarily have symptoms, which I think, we should definitely talk about some of those common symptoms.
We will.
But a lot of people are just, they don't like the way they look in clothing, or when they're sexually active, they feel uncomfortable and self-conscious. So those are all, that's all something we can address.
Yeah, they feel like there's just too much skin, too much like tissue down there. And sometimes they'll like even tuck it in so that it doesn't show in their clothing or other people don't see it. But I think the patients who are most symptomatic that I see are the really active ones. So patients who are running and that extra tissue just like kind of chafes, like it's actually quite uncomfortable. Or patients who bike a lot, especially with all this like Peloton craze. If you have too much tissue there and you're kind of sitting on a bike seat, then you're kind of pinching it, and that becomes very uncomfortable. And some patients have a lot of tissue, and that's really uncomfortable or kind of pinches during sex as well, because it kind of rolls in. It gets a little bit annoying, mostly to them, but it can be to their partner as well. And so it'll just be a little bit uncomfortable, or some of that tissue just gets a little bit irritated. So they're really usually incredibly normal, awesome patients who have really functional concerns that, aren't causing them a ton of pain, but they're bothersome. And if there's something simple that we can do about it, and also help the way it looks, then a labiaplasty is a super easy way to achieve that. So Do you see patients kind of all ages coming to see you for labiaplasty?
I do.
Yeah.
I do. I mean, I think the
It's so
spectrum is
cool.
so
Yeah.
wide, right? I
Yeah.
mean, I had a mother-daughter combo come in
I've
once,
seen that.
you know?
I've
Have you
definitely
seen
done that first. Usually I'll
Yeah.
do the daughter first, and then the mom will kind of watch. And then,
You're like, wait a second.
yeah. So, but yeah, I mean, that's the thing is like, just like anything else, just like breast surgery, like there's some people who go through puberty and it bothers them right away and they don't like the way it looks or the way it feels. And so we see like those younger girls. And then, you know, I think like in the 20s and 30s, it becomes a little bit more of an aesthetic thing because it's not so big that they did something about it sooner, but it just bothers them. And then, but then I also see older women who, especially women who are in new relationships or getting out of old relationships, and it's something that's bothered them for a while, and then they kind of just take control and they're like, you know what, I really want to do this for myself, and I'm going to feel a lot better about it. And it's such a simple thing to do that we see women at all those stages who just decide,
Right.
you know what, it bothers me enough that I'm going to do something about it.
Right. And I think, you know, as with any part in our body, it changes with aging too, right? So you
Yes.
definitely get that older population where you might have more deflation. And because of that, it sags a little bit more if you've had, you know, children and
Yeah, it can
childbirth can cause
stretch and-
changes.
Yeah.
Right.
Even
so it's,
even if you don't have vaginal births, just carrying the child can cause just
Yeah.
so much venous congestion of your lower abdomen and pelvis that it can really kind of stretch and change those tissues. So even women will be like, it feels so different. And I had C-sections, like how is that even possible?
Right.
But just because we carry those babies in our pelvis, it really does change those tissues over time, and so does all
Right.
the hormone changes.
Oh, of course. Yeah. I mean, it's so hormone sensitive. And so I think that's sort of the beauty of it is that we do see all of these women in so many different stages of life that
It's so fun.
have
Yeah.
either like concerns that they've had ever since they were, you know, went through puberty, or these are sort of new concerns. And, you know, like you said, the great thing about this is if you're healthy and this is something that bothers you, you're a candidate for it, right?
Right.
I mean, there's no right or wrong. This is a very personal decision. And so, you know, it behooves you to sort of look into it and go for a consultation and get some information to see if it's really the right thing for you.
Yeah, I mean, it's a really personal thing. I mean, I was just thinking about that as you say it. I'm not sure I've ever had a patient who came in because they wanted a labiaplasty where I told them that they really didn't need one, because it's
Right.
really just a very personal thing. If it's something that you want to be smaller or different, then that's exactly what we'll do for you. So as long as you're healthy and as long as your expectations are realistic, then
Right.
then if it's something that bothers you, then it's absolutely something we can address with a labiaplasty.
Right. And, you know, and like you said, it's such a simple procedure, and oftentimes we do it in the office and you're awake and comfortable and we numb up the area and it's quick. It's, you know, less than an hour, right?
Yes.
And, you know, there is some swelling and which can be a little scary afterwards, but, you know, your results are just so amazing. And I think these are probably one of our happiest patients.
Oh, yeah.
Wouldn't you say so? Yeah.
Just like anything else, you know, it gets swollen and bruised, and it looks almost like worse before it looks better, but that period is really
Yeah.
short. And as long as patients just take a couple of days or a long weekend to just relax and watch a bunch of Netflix and use a lot of ice, then, you know, they get back to work, and after a week, we're usually shocked at how amazing it looks right away. So it's just
And it's not necessarily
so rewarding.
painful.
No,
Yeah.
people do great. They say,
yeah.
you know,
It looks scarier than it feels.
Yeah,
you know,
it just gets
it's
swollen,
not very
but-
painful.
yeah, they do great. Patients do really, really well. And we just really set them up and tell them how to take care of it and how to ice and how to relax. And as long as they take care of themselves, you know, it's well worth it. I've never done a labiaplasty
Absolutely.
where a woman was like, oh, I should never have done that. They all are just already at a week absolutely
Yeah.
thrilled. They can't believe it's real, and that quickly everything is exactly how they've always wanted it to look.
Yeah. Yeah, it's
Yeah.
such a great procedure, and I'm glad that we're talking about this. And you know, we're going to have a whole series about labiaplasty and surgery itself and all and the recovery and all of
exactly.
that, because there isn't much out there, to be honest.
Yes,
you know,
there's
and
so many techniques,
I think we need to
so many things we can do. So we're going to go through all of it, you guys, start to finish. But now you know who's a candidate, and you know if there's something that bothers you, that's absolutely a good enough reason to have a consult. Find yourself a board certified plastic surgeon, and if you're most comfortable, you know, talking to a woman surgeon, then there's certainly quite a network of female plastic surgeons who really enjoy doing this and taking care of women, and we're excited to talk to you about it because this is a really cool thing that we're able to offer you as women. So check it out, subscribe, Lipstick and Lipo on YouTube, and there will be plenty more about labiaplasty from your unfiltered guide to plastic surgery.
Bye, guys.
Bye.